conventional femtosecond lasers available. So we did a contralateral eye study where we did one eye with an Intralase, the FS60 Intralase, and one eye with the Ziemer. And I'm just going to show you the results of that. I am consultant for Alcon and Intralase. I don't have any interest in Ziemer. And these are the two lasers. They're quite different. The mechanism of actions, I really won't go into that much just because of the timing here, but probably the biggest difference is you can put the Ziemer head right under your excimer laser rather than having a separate machine, and it is movable, and it has a significant different energy and smaller spot size. Just the study was 19 patients. One eye had FS60 and one eye had the Ziemer. They were the same diameter, same depth, superior hinges, so the only thing different was the laser, and they were randomized to dominant eye, and this is the 3-month results. And we did a lot of tests in this study to try to see what differences we would find, so it was a pretty comprehensive study. Now, as far as the technique is concerned, I'll see if I can run both of these videos here. The Intralase, as you notice at the top, I've done 10,000 Intralase and 35 of the other ones, so keep that in mind when you're looking at results or anything else. It's certainly in my maiden voyages with the Ziemer. Now, the Ziemer, you can see the magnification difference I'm on at this point in time, because it's quite different, because with the Intralase, you see I'm putting on a suction ring, and then I'll move the patient over, and the second step of this is then doing the docking. Well, with the Ziemer, it's all done at once, you know, and so you have to get it down to a lower magnification so you can actually see all the things that are going on. And see, this is the suction ring and the laser and everything all in one fell swoop. So as you're docking here, and they're docking kind of at the same time, so it gives you an idea of the pressure. But remember, the suction ring has already been on in the other one. Now, the Intralase is just going to kind of proceed here normally as you would expect and you've seen before in that side. And the other one, I'm waiting for the suction to build up, and that little wiggle there you do to make sure that it has good suction. And I've never had problems with that. It actually has the Amadeus suction ring on it, which, as you know, is a good suction ring. And the actual time here with the Ziemer is 25 seconds. And now is a camera on one. I saw it on the field that you can actually see underneath it, so you can see as you're docking. You can't actually see it making a flap. You see the Intralase is just kind of the regular flap lifting, and I'll show you the flap lifting on the other side, and these are remarkably similar, but that's just a standard Intralase. So the Ziemer takes 25 seconds, doesn't seem to be much of a problem. That's slower than the Intralase, but kind of everything comes off at once. Now, I'm going to be a little relatively slow here because these are our first cases, and we kind of had a protocol here that historically patients or doctors had reported problems with the edge, because the edge isn't cut like an Intralase where it's actually cut. It's just kind of like a meniscus, like a manual microkeratome that kind of fades out through the meniscus and the edge. So I kind of went back to techniques I normally use with a bladed microkeratome, which is using corneal marks, which I don't use with the Intralase. And then I put this on one other step in here that I just took a little hook and tested the edges. Now, it happens to be in the series that I did, and I did another series beside this study, and I never had any trouble with the edge on any of it. You know, I don't think I would have needed to do this step at all, but it was just part of our protocol to do it, to just check. And the company had suggested it, and some of the doctors before me, but I don't think it's necessary at all. Matter of fact, I've just picked them up with forceps. So